joining us all the way from Mexico City. He's a COVID-19 program director for the ABC Medical Center. So what is the situation like on the ground right now? How are medical facilities dealing with this enormous amount of coronavirus cases?
Yes, unfortunately, this has been a very bad couple of weeks because many of the hospitals that have intensive care units, critical care medicine, have been full. The reality is that the government is saying that we have a lot of beds, hospital beds, but the problem, as you know, this is a infectious that needs the intensive care unit to be the one that take care of the patients that need to be hospitalized. Right. So we're running out of good hospitals that have these critical care beds, and the increase in the death toll has been very, very sad.
Yeah, I mean, I see your face. You look just exhausted. I can't even imagine how other medical professionals are feeling right now on the front line of this pandemic. Do you think that the public is truly aware of what's happening and how serious this threat is?
Well, the problem is that we have had received different messages. One from government that says that everything is under control, and even though we have tried to make the society feel that this is something that is still running on, if you receive different messages for the population that needs to go out because of economical reasons, it's difficult to decide what to do, because if they hear that they can go out, that is safe outside, here the president will never use masks as a precaution measure. Even the Secretary of Health not use the mask. So we have had very difficult messages that have made this increase in number of patients and unfortunately increase in number of deaths.
Well, doctor, I mean, what I want to know is how long you think this is going to last, but also if you could send any message to the people, what it would be as a doctor who is seeing people with coronavirus.
Well, the message is clear. We're still having a high number of infections, new infections. So if you are able to keep working at home or staying at home, do that. And if for some reason you need to go out, just remember that you have to social distance. You need to have washing your hands and the use of masks, because we're still having a very high number of infections. And the other reason is if you have risk factors. In Mexico, one of the biggest problems has been obesity. Many of our patients that are admitted to the hospital, even though they are younger, they have a max and body index mass that is very high, and that has been a very bad problem. Mexico is the second country with the worst obesity problem. So this has been one of the reasons also that we have a high index rate.
All right, doctor, thank you so much for joining us. I hope that you're staying strong. It's hard to see your face. You look so sad, but you know, we're all praying for you over here, okay?